A new study finds that teenagers' brains actually aged rapidly during COVID-19, that lockdown era. The findings showing that teenage girls were more affected than teenage boys, potentially impacting their mental health and even their behavior. ABC's Rhiannon Alley with more.
A new study is revealing unusual changes in teenagers' brain development during the pandemic.
It's not that surprising to know that there are actual brain changes that happened during the pandemic, given everything that teens, especially teen girls, faced.
The study found COVID-era lockdowns ended up aging teenagers' brains faster than the usual rate, more than 4 years faster than usual in girls, compared to just over a year faster in boys.
The authors hypothesized that adolescent girls were affected more than boys because they may be more dependent on that social interaction and being able to connect with their friends.
Back in 2018, researchers began tracking brain changes in 160 people ages 9 to 17. They found lockdowns contributed to an increase of anxiety, depression, and behavioral disorders, causing their brains to mature faster. The same type of accelerated brain aging has been documented in teens who've suffered severe trauma, stress, and neglect.
But it's important to note that these studies don't exactly tell us what the long-term effects are or if the process can be reversed or slowed down with the right type of emotional support moving forward.
All right, so we've got to talk more about this. We want to bring in ABC News medical contributor, Dr. Alok Patel. Dr. Patel, it's good to see you. You sort of explained for us in that story what happened, but how concerned should parents be about this new finding? Parents already being concerned about what happened to the kids during COVID, and can the negative impact here be reversed in any way?
Well, I think parents should be just more aware about the true impact that the stress of the pandemic, stress from all around us, that's had on those developing teen brains. What the study really does is it adds some physical evidence to what we already know about how sensitive teen brains are during those critical years and how fragile they really are. Now, the headline is alarming, but it's important for people out there to understand that our brains go through changes with age, with maturity. And so some of these changes are not necessarily bad on their own, but they can be accelerated with stress. So I don't think parents should really panic from the headline, but what they should be doing instead is really doing what they can to pay attention to the emotional well-being of their teens and their young kids.
Yeah, that's always great advice. I want to broaden out here, but stay with the effects of the lockdown. At what point do you think we're going to know? How long-term do we have to go out to figure out what the long-term effects are of the lockdown on children and adolescents?
Bill, I'm so glad you asked that question. You know, when you look at a study like this one, we have to remember that this is a relatively small study. So it's hard to really extrapolate and say that this changes in the brain is going to be permanent or have some type of widespread effect on every single teen. Every child truly is different, and every age has different types of potential setbacks that may have happened during lockdowns, during anxiety. And it's also hard to tell, Phil, if these effects are directly from the pandemic or from a lot more teens being on these things, social media, global events. What is important to know is that people should have a sense of developmental milestones for their child, for their age, and it might be a few years before we really truly understand the impact, but it's really important that you pay attention to your own individual child, support them, offer a non-judgment zone to hear their concerns, and if you need help, you reach out.
Yeah, instead of looking for specific data, just realizing that everybody has troubles coming out of it. So we just talk to our kids a little bit more about it.
Many of us.
Many of us, Dr. Alok Patel, many of us. All right, thanks so much. Always good to see you.
Thank you.